Go ahead.
So first to Justin on the Blue Cross issue. On the issue of the demise of the Blues. Many of the Blues were bought up by the larger insurance companies. For example, WellPoint bought up Anthem, and Anthem had Blues in many different states. Started in Indiana, went to Kentucky, went to Maine, wherever. They had a huge number.
The question was when.
Yeah, right. But this is a process that went on for a very long time. So it's a process which began back in the 60s. But before that, one had a very different kind of insurance system. And that's what makes it so difficult to introduce a single-payer reform. Because at that time, early on, when insurance wasn't that common, when the insurers had a different approach to insurance than the for-profit thing, then it would have been easier. And that's why in many other countries you do have the reforms that took place within the last 10 or 15 years that were fairly easily done. Let me just give you an example that in Indiana, the Blues actually got together doctors and hospital administrators on a regular basis to study the distribution of health resources in the state. Now, this was in a public spirit. It was not as though, how can we get in there and get control of things? It was, what do we need? And they were, so it was a totally different atmosphere than what you have now. Jack, on a very good question about what kind of moral argument would I make, or what kind
Microphone, please. Some people can't hear in the back.
what kind of moral statements would I make? The first part of my talk, where I was talking about the social crisis, is to me the moral argument that I have. When we talk about morality, I think what we're talking about is what do we need to do to hold society together. Now, other people have a rather different approach, and they would go at it from the angle of saying we have certain rights and obligations, and we look for places where they apply. But they don't ask the question, well, where do we get these rights and obligations from? So I'm suggesting that we get them from our interest in avoiding social crises and social collapses. We want to avoid things like Darfur. We want to avoid things like Somalia. And those are the things that begin to, when we reflect on them, begin to reveal the fact that what we thought of as maybe a morality handed to us on a blackboard or in a book is really deeply embedded in our social trust, solidarity, and enjoyment of other humans. Okay, Stan.
Dan.
Or was it Dan?
Dan.
Stan. My understanding of the situation with the Harry Reid statement today is that he is saying we're going to pass a public option for the nation, and some states can opt out. It doesn't mean that we're going to have public options state by state. It's simply that it is a universal public option. You can decide you want it or not. It's sort of like the stimulus plan. The governors decided they wanted to opt out. They could opt out, but it was a national plan. The business about possibility that elderly people would pay more. I'm not sure what.
I heard that really driving over here on radio on these guys.
One of the things is that with the Medicare Advantage plan, people are getting more benefits, and they are getting, as a result, Medicare to pay larger amounts of money for their treatment or for their insurance. Now, if, as in several of the plans, there's to be a cutback on the amount that a person can get with Medicaid beyond the mean, then some people have thought that that would be a cutback in their benefits, even though studies have shown that there doesn't seem to be any difference as far as outcomes are concerned between Medicare Advantage and Medicare. Now, if they do cut back on Medicare Advantage, then those people who want to get the same perks that they were getting under Medicare Advantage would have to pay for them themselves. And in that sense, there might be, but I'm guessing, because I hadn't heard that.
The way I heard was that they were referring to the premiums, total premiums. We have to pay for Medicare, and this would go up for older people.
Right. I'm sorry. Okay, Jim, on Blue Cross, why not have a private,
not-for-profit.
a not-for-profit plan? I have not seen any real reason for saying that there is an inherent advantage in the single payer over the private type of plan. On the condition that the same kinds of restrictions and regulations that exist in a country like Japan are put on the private plans.
You're speaking of private, not-profit.
Yeah.
Yes, private not-profit plans. There are some disadvantages in those countries, but it has to do with other things than the fact that it's a private plan. For example, in Switzerland, there is no progressive structure in the premiums. We have no progressive structure in our premiums. Everybody has to pay the same for the same bundle of benefits, unless you get an insurer who charges less. In Switzerland, everybody pays the same, rich and poor, but rich can opt out in the Swiss system. They don't have, they're not mandated to have insurance. But those are all details about how the plan would work. I mean, if I could imagine a plan that I would like that was a private, not-for-profit plan, I would build in the fact that it has to be based on progressive premiums. That is, that they're on a sliding scale with income, so that the better off pay more than the rest. But those plans that do seem to work are very heavily regulated. You find regulations of all kinds there. And the premiums are set by the state.